We're back, right? It's been about 15-20 minutes. And what did I do while we were gone? This is part 2 of a series of videos that are going to teach you how to take really good notes and maximize the videos for nursing school, HESI, ATI, NGN NCLEX. So the first part talked about the handout. We covered what do you prepare with the handout. Some of you know what I mean by the handout because you've already done the self-study. If you do it this week, it's a $200 deal. So you get a $200 every handout I ever created. You get that for $200 when normally it's about $400 because it's Black Friday sale. So you already know what I'm talking about with the handouts. But what if you don't have the handouts? Don't freak out. Just use what? Notebook, right? You have to do what you have to do. Don't freak out. Seriously, it's not that serious. Okay, but now this video is the video, right? So if you have the Oh My God packet, which as you know, I was giving away for free for a long time. Now it costs almost free. It's $25 when it's like a $100 deal because it has so much wealth in it. But if you need it, let me know. Give me a call, 216, don't call me. I lied. Text me, 216-410-0936 if you're interested in the Oh My God packet, which is going to show you a little bit of this as well. There's also an Oh My God video. So anyway, moving on. So this portion of this video series of how to maximize free videos to pass every test you could ever be given. This is the note-taking portion from the video. So watch this. The HETV, and some of you don't even have it on your phone. You're not subscribed. You don't have the YouTube app. Make sure you do it right. You have to put all capital letters, H as in Harry, E as in Edward, T as in television, V as in video. So it's really health, education, television, HETV. You pull those videos up. I already told you earlier to download the YouTube app to your phone. You can play these videos anywhere, put them on your your Bluetooth in your car. You can play them while you're cooking dinner. You can put the little earbud in your ear and just walk around all day with it. Some jobs are pretty cool. They're not gonna fuss, especially on night shift. If you're doing your job and you've got this in your ear, some, may fuss, and that's why you grow your hair out. Put those bad boys in there and don't nobody know nothing. I did not tell you to break the rules. I did not. You didn't hear that from me. I'm just saying what I have done. Okay, so anyway, one way or another, you got to get this in your spirit, this information that you have a test this week on or next month on or whenever you graduate or final exams or midterms. You got to get it in your spirit. It can be played on the car. You can put the YouTube videos on your smart TV. You can play it on your cell phone, not just your laptop. Get in the habit of having the videos with you everywhere you go. Then make sure you always start with the playlist. Look at here. Always start with the playlist. When you go straight to the playlist on HETV, it's like a textbook, right? What did we say? Every playlist is a textbook. When you tap it, underneath are the chapters. So you already know to do that. But here's the deal. I'm not sure if you know to do this. Watch one video at a time and take notes on that video right then. During the video, if you can stop and start, rewind, fast forward, whatever you got to do. I try not to do that if I can because I don't want it to take too long. So just now when I watched the 16-minute video on eating disorders, I gave it to you straight. I watched it. I took notes on it. I'm about to show you how I took notes. When you take notes, you need highlighters, right? You need your highlighters. I've got 4 highlighters here. Boom. I don't think I used yellow because I didn't think you could see it, but whatever color you want to use is fine. I love yellow. It's my favorite color. But then I also have, for this note-taking experience, my colored pens. One of my students was so cute. She had a glitter pen, honey. She was doing it to death. So whatever you can do, but you definitely need colored pens and highlighters. Here's how the difference is between when you use a colored pen, when you use a highlighter. If I say something in my video that is actually on the handout, I use a highlighter. So let me show you what I said on the video that I used the highlighter for. I was talking about eating disorders, and I literally used the handout for the subject of the fear, intense fear of, becoming fat. I use a highlighter for, what else do I have here? Views herself as fat. I used the highlighter for feels powerless because it talked about her parents are controlling. I said the word pica, and I mentioned anemia. And if you look, iron deficiency is exactly what anemia is. That is how you maximize your note taking, so you're not writing everything, because you get frustrated. You're writing, and it's like you don't have time for that, right? So let's look at the next page, because remember we had 3 pages for eating disorders. In the anorexia page, I mentioned the difference between plain anorexia versus nervosa. I highlighted the nervosa. I talked about her looking in the mirror and seeing this image, so I highlighted that. Again, this fear of obesity. This says feels fat even when she's thin. That's huge. Okay, I can tell you right now, that is huge. Okay, so then you see more information, excessive exercise. I did say that. I even demonstrated like a little bit of the exercises. So of course I highlighted it. I don't want to write it. I want to highlight things that are already on the packet. You cannot keep up with just writing every word I say. That's crazy. You need to maximize a handout. Then I talked about bulimia. So I highlighted bulimia, I highlighted the binge eating, and I put here that 1/2 hour, because binging means really fast. I put 1/2 hour. Other things that I highlighted that were actually said or alluded to, right? Because you got to know the meaning of words. It says that they sneak to eat. I said that very word. That's the same thing as solitude. They're not going to do it in front of you. They're sneaking to eat all this, right? I said that their mood goes up. They feel good when they eat. So I highlighted that. Later on, I talked about depression and guilt. So the mood goes down when they stop eating. I need you to really look at the pictures on your handout. Many of you don't, and that's a big mistake on your part, because I mentioned repeatedly that this patient likes sweets. There is nothing in words on this handout about sweets, but if you really paid attention to the handout, this is a candy bar. These are cookies. These are donuts. This is pop. And so I highlighted that because I said she likes sweets. I mentioned that she can vomit, and that's what the purge means. I didn't say the word purge, but I definitely talked about vomiting and laxatives. So again, if I say it, then you highlight it, right? That's huge. What if it's not, if I say it and it's already on the page, you highlight it. What if it's not on the page? Well, then I got to write it. And I'm going to tell you what I did just to continue this video and show you how to do a full circle study session. I literally used only 2 colors because I want to point something out. I used blue for anything that I said in the video that was important, and I wrote those down. I put on the first page, both of these patients need to keep journals. I put that anorexia nervosa was a lifetime problem. I put that she's terrified, because that word was used a lot. And then here I have both of them keep the journals. And over here I have the don't focus on the patient's weight. So if you weigh them and they did good, don't even talk about it, right? So I said that, right? And then instead of anemia, there was nothing that said anemia, but this means anemia, the iron deficiency. and then I wrote anemia after it. And then I went to the anorexia nervosa. I actually went there first because it sounded like they were going to focus. I was going to focus on that first. And I just took really good notes. I made sure I wrote down a huge issue. This is fatal. CHF and electrolytes. I wrote down, this is this child's attempt to regain control. I wrote down, where's big clothes? You know, I wrote down diuretics and laxatives. I wrote down, let's see what else, controlling parents, overwhelming, you know, highly educated, fairly wealthy. I wrote all of that down because that's going to be a tip on the test. And then when I got to bulimia, I wrote the guys that were wrestlers, the girls that were models and cheerleaders. I wrote the fact that this patient is often a normal or overweight. That's a big distinction because this anorexia lady is super thin, right? I wrote that they love sweet foods, right? Issues of guilt and depression over the fact that they overate. Then I don't know if you caught this, but I also wrote down that vomiting leads to metabolic alkalosis. And then I wrote down what happens when the binge is over and what binging really meant, like vomiting, right? So I wrote down, uses knuckles, gets calluses, and then the teeth are rotted away from the acid. Ooh, okay. So that's what I did. Now, I only used 2 colors. I don't care how many colors you use. It's not the point. My point when I did this using 2 colors was that I wanted to show you in the next video how to do the questions on your software and then take notes on the rationale, for which I'm going to use a different color pen to distinguish the notes I took from the videos from the notes I took from the actual YouTube questions that YouTube, UWorld RN questions that I'm going to show you. But we have one more thing to show you, and it's important. I started talking about psychosomatic disorder. There is no handout for that. So you kind of got to throw it on a sheet you didn't write a V on. See why you had to know your packet ahead of time? Because if you know your packet ahead of time and you wrote your V's on everything that had a video attached to it, then you get to the point where you're like, oh, she's talking about something that there's no handout for, because I remember I already looked in there and I know there's no handout for it. And so, I'll just put it on a sheet with no V for video on it. And so that's what I did. I chose to use the last page and write psychosomatic disorder. I wrote the fact that this patient has a headache, back pain, stomach pain, pelvic pain, and that that's not a lie. They are actually in pain. I wrote the fact that tests and labs come back normal. I wrote that they need a psych referral, but don't say psych. Use the term counselor or say, I have somebody I want you to talk to. I wrote down the fact based on the comment made in the classroom at the time of the video about this child that was in pain. I wrote down the fact because I thought it was critical, especially for just us as a people, right? I wrote down that 1 in 3 are molested and 1 in 7 are doing the molesting. I think we all could use that information to, better serve our families and our friends and our loved ones, students included. I've had to diagnose students' kids with this issue because they came and confided in me about something that was completely bizarre. And I said, I recommend that you go and check out whether or not they've been molested. And they were. Okay, so bedwetting, all that kind of stuff. Okay, so that's that. That's the end of this video. Now, the next video. When I get off this video, I'm not done with you. The next video is kind of fun because I'm going to do 25 questions on psych and psych meds. And by the way, when I did this video, I don't know if you figured it out. I didn't say see anybody first, so there was no need to do anything in the Oh My God packet. I didn't have any medications to give these patients, so I didn't do anything in the psych meds packet. However, that is not going to stop me when I do my UWorld, and you'll see me do it right here with you on the video. That's not going to stop me from not clicking those two options. So I'll be back. You go get your UWorld. Let's get ready to jam together, okay? Because if you do this with me, you might get some of the same questions I get, and then you'll know how to answer them. So come on, baby, let's do this. You got a license to get, or you got a school to graduate from. This is until a minute from now. Well, not really, but soon.